People come in acute pain, and they don't even know they're clenching their teeth at night or during the day or both, causing this damage to their teeth. It becomes very expensive. It can be very painful, and it can even get infected and send them to the hospital.
This is MedSpa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I am here with my good friend Rachelle Cohen today, and we are talking about teeth grinding and clenching and different treatments for that. And Rachelle, can you introduce yourself?
Sure, Kate. I'm Rachelle Cohen. I have an endodontics practice where I specialize in root canals. Had it for about 20 years in Seattle, Washington. Went to school at Tufts University, University of Connecticut, and the University of Washington for all my training.
Okay, awesome. Thanks so much for talking about this with me today. So I know over the years we've talked about how bad teeth grinding is and different options for it. And I know that you've sent me a bunch of patients to do Botox. So I was hoping that we could talk a little bit about what bruxism is and what problems it can cause, and then what are the treatments.
Yeah, absolutely.
Can you just launch into what is bruxism and why is it a problem?
Yeah, in dentistry, we've seen quite a surge in cracked teeth recently, especially since the COVID pandemic and all the stress involved in that. There's been a lot of articles written in the Times. There was an interesting article written by a dentist in New York City who noticed that. And for sure, it's become an increasing problem. People are cracking their teeth. People are losing their teeth at just crazy levels compared to back when I began practicing.
I didn't even know that. So of all the many complications of COVID, cracked teeth.
Yeah.
Okay.
I think it was happening before a lot, but I think that it was quite
It's getting worse now.
Stress related, probably. I think that people are cracking their teeth because we all have these really large amalgams, these big silver fillings in our teeth. And the problem is kids that 60s, 70s, and 80s fillings were always these big, massive amalgams, these big silver fillings.
I'm embarrassed to say that I have a few of those. I do.
Yeah, we all do.
It's terrible. It's bad parenting. We'll just say my parents must have not made me rinse with my fluoride.
I think it was just the style.
Can I blame my parents for that?
You totally can. We're parents for a lot of things. And now we're parents and we're getting blamed. These teeth are cracking now because those silver fillings undermined all the cusps. So it wasn't the plastic fillings, the composite fillings bond to our teeth. But the silver fillings, we had to drill these big shapes to undermine the cusps to get the amalgam to stay in there.
Oh, that's what all that drilling was about.
Mm-hmm.
Okay, that's good to know.
That's why they're so big.
Gotcha. Okay. So what's happening is people are stressed out and they're grinding their teeth and they're clenching, and that puts a ton of pressure on their teeth. But the thing that I've noticed is that they're grinding all the time, so their masseter muscles, the muscles that do clench your jaw, those get bigger and bigger. So actually that grinding gets stronger and stronger over time.
That's absolutely right, yeah.
So as that muscle gets stronger, eventually it's strong enough to crack the tooth.
Yeah, it's an amazing amount of force. You can put something like 200 pounds of force on your back molars, and it's those back molars that get the most of it. They get the lower second molars and the way back are the ones that crack the most, which can be really dangerous because if you crack a tooth, it can get infected. And that's what I see as an endodontist. People come in acute pain, and they don't even know they're clenching their teeth at night or during the day or both, causing this damage to their teeth. It becomes very expensive. It can be very painful, and it can even get infected and send them to the hospital. So it's something that we really want to nip in the bud and see, hey, number one, identify who's clenching their teeth at night or during the day and figure out some treatment modalities to stop this so that they don't hurt themselves. I mean, an implant's upwards of $10,000.
They're very expensive.
Yeah.
How can you tell, if you don't already know, how can you tell when someone's grinding their teeth?
Yeah, a lot of people don't know they're doing it. There's daytime and nighttime grinding, and the daytime type is just people clench their teeth. It's a habit. It's like chewing your fingernails. And that's something that you can really stop doing. You can be mindful if you're in traffic, for example, people clench their teeth, or if you're at the computer, people clench their teeth. Sometimes if I'm doing a really hard surgery, I'll notice that I'm clenching my teeth. It's the nighttime grinding that a lot of people don't know that they do.
Right.
And they say, oh, I know I don't do that. But you're right. The masseter, if you look at somebody's face, they have that, you know what I'm talking about.
Very, very large jaw because their masseters are so big. I once had a patient that I was doing a consultation for skin stuff, and she literally had the biggest masseters of anyone I'd ever seen. And in the middle of our consultation, I asked her if she grinds her teeth, and she was just like, do I? Oh, it's terrible. I've already had 3 implants, and I grind right through the night guards, and it's just terrible. And when I offered her Botox, she had never heard of that. But we'll get to treatments for it in a little bit. But she did. Those masseters got a lot smaller once we were able to Botox them. Yeah. So their masseters are big. I think also people wake up with pain in their jaw or a headache or both.
Absolutely. Or they get headaches during the day and they don't know why. There's a kind of a funny little thing where if you look at your tongue, you stick your tongue out, it's on the sides of it, it's scalloped and white. There's a little white line. And that's what you see a lot with cracked teeth. I know.
I'm busy doing it now.
Yeah. If you've cracked a tooth, the likelihood that you are clenching at night is pretty high.
What if you cracked a tooth on something really crunchy? Is that the same or is that different?
It's probably different. Hopefully it's different.
I did that though.
Did you do that?
So there was a cereal called Go Lean Crunch, in case anybody remembers that cereal. I don't even think they make it anymore because probably too many people cracked their teeth on it. But I actually cracked 2 teeth opposite each other from one big crunch. It was terrible.
Were they teeth that had big silver fillings?
Yes, they were.
Yeah. Amen. Tista. Yeah, for sure. I think that.
Okay, I'm glad I'm sharing this with all of you. Okay.
I remember that cereal, Kashi.
Yes. Yeah, I don't have it anymore.
Yeah, stay away from the grape nuts. I think another thing that's a problem is that we're trying to be so healthy. We're eating these things that are so healthy for us, and they're harder on our teeth. Vegetables are harder on our teeth. So there's this thing where we all have these big silver fillings. We're getting older. We're keeping these teeth for a lot longer than we did back in the day. A lot of people were in dentures by the time they were our age. And people are cracking their teeth. Another thing that's really a big cause of bruxism, which is the scientific term for, clenching and grinding, is the antidepressants. So Prozac, Effexor, Wellbutrin, a lot of these SSRIs, one of the big side effects is that it upregulates this clenching. And
I had no idea about that. That's really interesting. So it's something in the water nowadays. Who's not on an SSRI? Wow. Okay. So do we know the incidence of teeth grinding?
So in North America, it's the highest. And they think it's about 30%. A lot.
So almost a third of people are actually grinding their teeth. Mm-hmm. And so some subset of those people don't even know that they're doing that.
I would say a lot of them don't know.
Interesting. But if your masseter, so your jaw muscle, the one, if you just clench, that's the one that gets bigger when you do it. If that's really big and you're noticing that, chances are you're grinding your teeth, possibly at night when you don't know. And aren't there findings that you can see on the teeth where you can tell that people are grinding? Can you describe that? Because
you can get, aside from the cracked teeth, which are pretty obvious, you can get little wear marks, little wear facets that are like these little potholes, or you'll see that like the biting surfaces of your teeth are starting to wear down a little bit. Those are signs. Your dentist will usually nag you about it and say, oh, it looks like you might be grinding your teeth. You'd be surprised at how many people think it's like an offensive thing and they say, I don't do that, but it's when you see it I'm a terrible tooth grinder. I have no idea I do it, but yes, I have no idea, but I do for sure. So I think that.
Do you wake up with jaw pain and stuff?
No, but I know I
do it.
Yeah.
Okay. let's talk about what to do about it. So the thing I think maybe people find it quote unquote offensive is because nobody really wants to wear those night guards. So talk about that. So that seems to be the first line of treatment are these night guards.
Yeah. I think that a night guard is really important because you can't put that localized pressure on one specific tooth, and the incidence of fracturing your teeth when you wear a night guard versus not is much lower. So
Okay,
we
so
know they're working.
So can you just explain how you make a night guard, what it's supposed to do? Is it molding to your teeth? And obviously I don't wear one, so I don't know.
Yeah. So you can buy over-the-counter ones, but I don't recommend it. So the ones that you can buy, these ones that you can boil and bite down on at Walgreens or Rite Aid or whatever. But that can act like braces and shift your bite. So you have to be really careful with those long term. What your dentist will do is they take an impression or mold of your teeth, or sometimes nowadays we just scan it digitally and then make a little acrylic splint. It's almost like a horseshoe shape. There's lots of different kinds. But the most comfortable ones are just these hard acrylic splints, and you just pop it in right before you go to sleep.
And is it on both the upper and the lower, or just one?
There's so many permutations and combinations of night guards, shapes, sizes, upper, lower, kind of depends.
Okay.
But the problem is a lot of people can't tolerate them. They just can't. They can't sleep with it. A lot of people who have sleep apnea have their CPAP, and it's just too much for people. So I think that a new modality that's really helpful is what Kate was alluding to earlier, is the Botox treatment, because there are a lot of people who cannot tolerate a night guard, no matter how many times they've tried and no matter how many shapes and sizes they've tried.
Yeah. And I don't know. So it didn't seem appealing to me. But besides putting them on before bed. Yeah. I had learned how to do Botox for teeth grinding a long time ago. And I started this like 10 years ago. And at the time, it seemed like there were just a couple dentists who believed it was good and everybody else thought I was crazy. Has it become more accepted as a treatment for teeth grinding now?
Oh, absolutely. And we've had courses that a lot of dentists have been taking to learn about this kind of thing, using Botox and Dysport in the masseters. We've been using the botulism toxin or botulinum toxin for years for headaches, right? And
for all kinds of things. Yeah, it's been used since the 70s for various medical purposes. Mm-hmm. And when I started learning how to do this, so the masseter is a pretty giant muscle compared to the other tiny muscles. We use Botox for wrinkles. So it's actually pretty easy to do. And it takes a fair amount of Botox on each side. Usually it's 20 on each side that we do, 20 units. Although a lot of times I will start with 15 on each side and then go to 20 next time to try to not do it too rapidly. But basically what it does is it weakens the masseter just enough that it's not grinding anymore. So you can still eat, you can still chew, you can still talk, but that masseter doesn't have the strength that it used to have to grind. And a lot of times the grinding actually does stop completely. And people will know right away, because as soon as the Botox or the Dysport or whatever toxin you're using is in effect, they're waking up without the headache anymore. All of a sudden they're like, oh my God, it's the first time I've woken up without TMJ pain or a headache in so long. And the reason I start with 15 rather than 20, a lot of people will just start with 20, is especially for those of us who are not spring chicken. I don't know. Maybe we're both spring chickens, but I don't know. Anyway, if you already have a little bit of laxity in your skin and you take a very big masseter and you make it smaller very quickly, you may notice the laxity in your skin. And all of a sudden you get a little jowly that you didn't have before. Your jowls are a little bigger than they were before. And people really don't like that. But the truth is your masseter is taking up a lot of space that it's not supposed to be taking up. So you're going to lose that volume. So I try to do that a little more slowly. And sometimes 15 is enough, but usually you need 20. And so what happens is Botox takes its effect in 1 to 2 weeks. I like Dysport because it's a little quicker. It's 3 to 5 days. And really within a few days, people notice they're not having that pain anymore. And so it's very interesting. So one, the masseter gets smaller and weaker. And so even if you did go back to clenching and grinding, it's not as strong now. So it may not be as strong to actually crack a tooth. The other thing is that some people will actually train themselves not to grind anymore. So they're used to not grinding. And I know this feels this way for me on my face. So I do Botox for my 11s, those two vertical lines between your eyebrows. And I used to be always frowning and always had this face, and I always looked angry even when I was just thinking. And so when I started doing that, it took that away. But what I noticed is that even when the toxins worn off, I'm not doing that anymore because I just trained myself not to do it. I just don't make that expression so much anymore. And I do think that's what happens with grinding. So I do think there are many people who graduate to not needing the Botox anymore. And I've definitely seen that in my practice. So that's not everybody. Some people are just a ball of nerves and they go right back to clenching as much as they did before. But I do think that it's not necessarily a forever thing. And I also think that if you keep the masseters smaller, you are much less likely to do that kind of damage to your teeth. And so that one patient that I mentioned, she had already had 3 implants when I met her, and she really had enormous masseters. And so this is quite a while ago now. We treated her. Masseters are totally normal. She looks amazing, and she has not had any issues with teeth grinding. This is probably about 8 years ago when I met her. So it really can be life-changing. And if you're not grinding, there's a potential you won't need a knife guard anymore. I know that's controversial. So
Yeah, I'm in the belief that everyone should have a night guard because my
we all look equally doofy.
Yeah, exactly. So nobody can make fun of anybody else at night. No, but I do think that I do agree with Kate 100% that I feel like this is almost like it's a way to train people, get rid of that muscle memory of that tension that just holds in people's masseter muscles. If you can just chill it out, teach it to calm down and relax and get it a little weaker, then people can break habits and save thousands and thousands of dollars of dental work and failed dental work because, implants don't like people grinding on them either. So I think that Botox and a night guard, no matter how sexy it is the way to go.
Yeah, and I would say let's talk cost because I know cost is going to be firm if you're listening to this podcast about cost, but on average, just ballpark, what kind of realm are you in for a night guard and for an implant?
That's a really good question.
I don't actually know the answer to either of those things.
The worst thing about cracked teeth is that it's a cumulative thing. You crack it, you get a crown, then you're still clenching on it, so the crack gets worse. Then you get a root canal, then you crack it more, then you get it extracted and get an implant and a new crown on the implant. That's
a lot.
15
so first of all,
$15.
Yeah, 15 by the time we are doing all that because I hate having dental work done. Hate it.
We're still friends, though.
Oh, and I would go to you if I need to have this done, but oh my God. So all those procedures and that much, and because people talk about, and is all of that covered usually, or implants ever covered, or sometimes yes, sometimes no?
It's a long story. Dental insurance is definitely not health insurance. The maximums haven't been increased since the 70s. So people have usually about an annual maximum of $1,000 to $2,500 if you're lucky.
So essentially most of this cost is out of pocket.
Yeah.
Because it's definitely out of pocket for Botox. So it really doesn't, as far as I know, I haven't seen anything that covers Botox for this. And so that could be, if you're doing 40 units, that's going to be in the $500 range or more even. And does that last for 4 months? Does it last for 6 months? It's hard to know how often you need to do it. Maybe over time, you won't need to do it so much. And people think, oh gosh, I don't want to pay that. But at the same time, if you're looking at paying for one implant, forget it. You probably could have done Botox for many years and avoided the implant and maybe over time get off the Botox. So money-wise, it sucks no matter how you slice it.
Totally.
It's going to cost a lot. But as far as the pain, I will say that doing the Botox, it's very straightforward to do. Of all the places we inject, for the most part, I would say the vast majority of people don't even feel it.
Yeah, it's painless. It's
really
area.
And there's almost nothing that can go wrong. I have to say, in the 10 years I've been doing this, I've seen 2 complications. So one was where the injection created a little weakness in the middle of the masseter, and there were portions around the edges that still were strong. And when she clenched, it created this little bulge. It was really goofy looking, very easy to fix with a little bit more. So that was fine. But for a little bit, she He came in like just on one side in one spot. So that was unusual. I was, oh, wow. So in 10 years, I've seen one time like that, but that was fixable. And the other time I saw where there was a little bit of migration, it wasn't placed perfectly. And this woman ended up with an uneven smile for a short time, which really was terrible. And so that can be the case anytime you're putting Botox in someone, if it goes into the wrong muscle or adjacent, or if it travels a tiny bit to the next door muscle, you could have a bad cosmetic outcome. But again, that will fade, that will go away, thank goodness.
She could tell people she just went to the dentist.
It's never good. If you do this long enough, you're going to see complications. But so in 10 years in many patients, I've seen those two things happen. And I think probably one bruise once, but bruising is par for the course when you put needles in people. So for the most part, it's a really straightforward procedure and really easy and just makes people like so much happier. And I do think in the end, it'll save you dental work, but also save you money, should in the end.
Absolutely. I think it would absolutely save you money, because if you think about it, you have 32 teeth and you times that by a bunch of implants. Yeah. So I think the Botox is a much better deal and so easy.
Yeah. So if you do have teeth grinding, or if you maybe have it, you're not sure, you wake up in the morning with headaches, it's worth talking to your dentist about. Not all dentists do Botox for teeth grinding, but almost any place that does Botox will be able to do it for teeth grinding. It's actually really easy because it's such a giant muscle, you can't really miss it.
Especially on a grinder.
Yeah. Is there anything else you want to leave our audience with about this topic?
No, just remember to brush and floss.
Okay, brush and floss. All right. Hey, Rachelle, thanks so much for talking about this with me today. I've really appreciated our conversation.
Thanks for having me, Kate.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's drkatedee.com. Or reach us through the website, MedSpaMayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.